Welcome to Medinnovations Worldwide. Medinnovations is changing the face of healthcare using RFID technology. In this presentation, we introduce Pams, our flagship persons and asset management system. Pams is a complete full facility asset tracking, alerting, and reporting solution. Using RFID tag and reader technology, combined with Medinnovations' powerful intelligent database engine, Pam's tracking of your most critical assets is supporting healthcare in these key areas: time savings, asset loss and security, patient monitoring, regulatory compliance support, asset utilization and asset allocation, and budgetary planning. The benefits of Pams are realized across healthcare departments, including nursing services, biomedical engineering, surgical services, materials management, and environmental services. Readers are strategically placed throughout a facility. These innocuous ceiling-mounted devices broadcast a specific radio frequency to communicate with an RFID tag. An RFID tag is placed on each asset desired for tracking: persons, wheelchairs, beds, carts. There are few limitations to the type of assets that can be tracked by Pams technology. The third primary component of Pams is the locator engine, and performs all system functions including computing asset location, managing data, and providing data management tools such as the Pams user interface. A microchip embedded in each RFID tag is activated when in proximity to a reader. The pre-programmed set of information on the chip is captured by the reader and transmitted to the locator engine. When an asset moves into a reader zone, the tag chip is activated. The reader collects the data and transmits it to the Pams locator engine. When the asset moves again into a new zone, the process is repeated. Multiply this activity in a facility with thousands of assets and unique zones, and this is Pams in action. The Pams user interface is accessible from all facility computers equipped with an internet browser. Accessing data is fast and simple to use. Most information in Pams is accessible in 2 clicks. Pams integrated security modules offer custom alerting and security functionality. For example, an asset exiting the facility or entering a restricted hospital zone may trigger an alarm, activate a security camera, send an email or text message to a specified contact, lock down a security door, or record an event in a journal. This feature is an integral component of asset loss prevention and high-risk patient monitoring. Pams archives historical data for detailed asset usage and asset travel reporting and creates another high-value benefit. Using Pams' dynamic reporting environment, create reports such as asset type utilization by department, or time assets were located outside of their assigned home zone. Both standard reports greatly support asset allocation and budget planning. Pams extras include an integrated service reminder feature, and Pams data may be integrated with existing preventative maintenance software applications. In this section, Dr. Alan Wiesenthal shares his experience with Pams.
Locating assets quickly is only part of the Pams advantages we've found. The benefits trickle down to almost every department in the hospital: biomedical engineering, materials management, environmental services. Almost any department that uses any equipment in the hospital has found the system useful. The Pams interface is intuitive, it's easy to use, and really was designed for people who have absolutely no computer experience. With the mapping module, Pams not only told us where an item was, but gave us a visual picture of the outlay of the floor and what room the item was in to make it easier to find. Pams allows for tracking of items both in real time, but the administrative functions allowed us to go back over a period of time from days to months to see where something was being used, how often it was being used, and we found items that hadn't been used in months where we thought we were short of certain items. So it allowed us to better use the equipment that we had. After allowing Pams to track our equipment, we began to realize that the equipment that we thought we needed in certain areas wasn't needed. Pams allowed us to reallocate capital equipment to other wards and other services. The RFID technology in the Pams system allows us to better manage at-risk patients such as newborn patients, newborn babies, as well as patients that might be at risk of wandering. Pams can set off alarms, can lock doors, or warn security that somebody has gone out of a prescribed area. After Pams was installed, the system was almost unnoticeable. The tags that are applied to items are small, inobtrusive, and even the reading system, the antennas and the readers that are installed in the hospital itself are unnoticeable. In terms of cost-benefit analysis, it almost seems like a no-brainer. At the most basic level, an emergency room such as the one here locally loses anywhere up to $100,000 of equipment that either gets stolen, gets put in the garbage, or gets sent to the laundry and never gets returned. If we simply look at the amount of money saved by prevention of loss through shrinkage and theft, and forget about all the other benefits, the return on investment is obvious and really a no-brainer. Everything else becomes gravy, and the gravy is significant and trickles through almost every department in the hospital.